Basically, the answer to this question is that we can perform liposuction anywhere on the body. Basically, the areas where we perform liposuction, such as the abdominal region, for instance, the waist area, the area extending from the waist to the sides and back, which we call the love handle area, the hip area, the inner thigh and inner knee areas are the areas where we perform liposuction most often. In addition to this, we perform liposuction on very thick legs below the knee for slimming purposes. For instance, we perform liposuction in cases where the arms are very thick. For example, it might sound very interesting, but in patients whose face looks very fat compared to their body, we use liposuction to reduce the fat tissue in this area. We perform these. Especially in women, it is sometimes necessary to perform liposuction on the upper part of the genital area, which we call the Mons pubis. Particularly for our female patients who have a very visible bulge when wearing pants, swimsuits or bikinis, that we may need to perform liposuction there too. Of course, there are cases where we perform liposuction on the outer lips of the genital area in women for slimming purposes. Naturally, the important point here is to recognize that it involves regional characteristics. For example, in the liposuction we perform for leg slimming below the knee. In any case, we must avoid high-pressure aspiration, which is the process of removing fat using high pressure. We should work with a little lower pressure and in a more controlled way so that we can achieve a more careful, more meticulous and perfect outcome. Particularly in the arm region, one must be very careful regarding the nerves. As a matter of fact, when performing a surgery, we should perform these surgeries with serious meticulousness even in the smallest surgery. However, I would like you to know that basically liposuction can be performed on every point of the body.